22 new COVID-19 cases were confirmed today. For the third straight day, the new cases were all imported. They were placed on stay-home notice or isolated on arrival in Singapore. The Health Ministry will release more details tonight. The number of imported cases has been on the rise, not unexpected, experts are saying, as Singapore lifts its border restrictions. Well, let's bring in Associate Professor Alex Cook, Vice Dean of Research at the Sawswee Hock School of Public Health. Welcome back, Prof. So since December 29th, we've been seeing double-digit figures in our imported cases every day. 42 were reported yesterday, a 9-month high in imported cases. But is there a number or a scenario that would point to the situation being untenable in Singapore?
So I think there are two main things that we're concerned about when it comes to imported cases. So one of them is the impact on our healthcare system. And so far, actually, the imported cases that we've been seeing, even though the numbers have risen quite a lot, it's not actually got anywhere close to threatening our healthcare system. I think that we have one person in ICU at present. And if you go back to maybe March of last year, we had around about 30 people in the ICU. So I think that we're very far from the point at which we were when we went into the circuit breaker last year. The second thing that we're worried about is the risk of spillover infections into the general community. And so far, although we've seen a slight rise in the number of community cases, but actually the number is still very manageable, and it's still quite a lot lower than it was even as we were coming out of the circuit breaker into phase 1 and phase 2. So at present, I don't think we have much to be concerned about.
You know, there will be imported cases that are missed for whatever reasons. What do you make of the potential impact that these will have on community transmissions, Prof?
So we think that even with a quarantine of around about 2 weeks, some infections will be missed. We know that there are some people who have a longer incubation time. There's some people who will be infected just before they fly, so that actually they only have symptoms quite late on in the quarantine. And we know that the tests are not 100% reliable. So there's always going to be some risk of people emerging out of quarantine and then still being infectious or developing symptoms after they've been released. Now, we think that the current safe management measures that we have in place should be sufficient to mop up the majority of those. And that's one of the reasons why, despite the fact that for months we've been seeing quite substantial numbers of imported cases, we've not been seeing a rise in number of community cases that is commensurate with that.
Well, currently the same border measures and stay-home notice requirements apply to both vaccinated and non-vaccinated travellers. That may change, though. So, Professor, should vaccinated travellers be completely exempted from quarantine in the future?
Well, it's important to realize that the vaccine is not 100% effective, although it is very good. The efficacy is around about 95%. That does mean that some people who have been vaccinated, especially early on after the period in which they've got their second dose, may still actually become infected. We don't know yet whether they are a cause of concern for spread to other people, or they may do. So what I suspect may happen is that as a number of people who are being vaccinated increases, in particular in younger age groups, when it starts to move on to the general population, that there'll be increasing demand from people who've been vaccinated to get different treatment when it comes to the border. And there'll be countries that will be desperate to get the additional revenue from tourism and business who would be willing to relax their measures for people who've been vaccinated. It may be that people who've been vaccinated will still need to have an entry swab, but they may be able to bypass quarantine. However, it is likely to be different from country to country because all countries will have their own policies.